This video is going to illustrate step by step the events of the cardiac cycle. Don't view this video as a summary. It is an illustration, and the video that follows will be a quick summary of step by step what happens. I'm going to use this animated view of the heart. It's a very simplistic cartoon, but if you look at the figure on the screen, you've got three chambers or vessels. On the left side of your screen is the left atrium. In the center of your screen is the left ventricle, and on the right side of your screen is the aorta. For each of those three spaces, there are pressure values listed, and for the ventricle, there's a volume listed. For my students, I honestly don't care about the specific numbers. What I want you to know is relative numbers when things are higher or lower in one particular chamber, and I want you to know the names of the extremes in volume. But I don't care about the volumes per se. So as this proceeds, the volumes or the pressures are going to change. Focus more on their relative value than trying to memorize the exact numbers. In addition, valves are shown here. On the left side, we have the atrioventricular valve. Since this is the left side of the heart, that's the bicuspid. On the right side of your screen is the semilunar valve, in this case, the aortic valve. And if you notice right now, pressure is greater in the ventricle than in the, is greater in the atrium than the ventricle. And so that AV valve should be open. But pressure is greater in the aorta than in the ventricle. And so that valve actually should be closed at the moment. So let's go ahead and close it. Now, at the moment, we are at the end of ventricular diastole. We're at the end of ventricular relaxation, and we're about to begin contraction of the ventricular myocardium. So we're beginning with a period called isovolumetric contraction. During this time period, the QRS complex produces contraction of the ventricular myocardium, and that contraction leads to a rapid increase in ventricular pressure. That rapid increase in pressure, in turn, causes the closure of the bicuspid valve because pressure in the ventricle exceeds pressure in the atrium. Notice at this point, pressure is still greater in the aorta than the ventricle. So at this moment in time, the semilunar aortic valve remains closed. Pressure in the ventricle has increased, but volume remains constant at end diastolic volume, in this case a value of around 130 milliliters of blood, because all the valves are closed. Contraction of the ventricular myocardium continues and takes us into the period of ventricular ejection. We're still in systole, and at this point, continued contraction of the ventricle causes continued increase in ventricular pressure. As that pressure increases and ventricular pressure exceeds aortic, semilunar aortic valves open, and blood is now able to move from the ventricle to the aorta. And as it does so, we're going to see pressure in both the aorta and the ventricle increase as that blood flow occurs. And as the blood flows from ventricle to aorta, that causes the volume in the left ventricle to begin decreasing. Now, the critical thing to note here is eventually that decrease in blood volume in the ventricle causes pressure within the ventricle to drop. This is a hard concept for people to grasp at first because you have to remember what we mean by ventricular pressure. I'm not talking about muscle tension within the wall of the ventricle. I'm talking about the ventricular pressure, the force exerted by blood contained in the ventricle on the wall of the ventricle. As you remove blood, even though the ventricle is absolutely positively still contracting, it's contracting on an increasingly smaller volume of blood. And that decreased volume of blood in the ventricle will continue to push back less forcefully. And so, in essence, pressure during ejection in the ventricle initially increases because of contraction, but it eventually decreases as ventricular volume declines. Pressure in the aorta is also going to fall off at this time because you have to remember the blood that's ejected into the aorta doesn't stay there. It doesn't stay put. It keeps on moving to other parts of the body. So as pressure in the ventricle drops and the blood's being squeezed out less forcefully, the aorta is under less pressure. But as long as ventricular pressure remains close to or above aortic pressure, the aortic valve is going to remain open. And that brings us to the end of ventricular systole. And we've reached a point called end systolic volume. Here, about 60 milliliters of blood, which represents the minimum volume in the heart during a relaxed sinus rhythm. Now, this begins ventricular diastole, and diastole begins with a period of isovolumetric relaxation. During this time period, the T wave has now occurred. The ventricle has begun to relax, and as it's relaxing, its volume, physical volume is increasing, and that causes the ventricular pressure to drop sharply. As soon as it gets below aortic pressure, the aortic valves close. Now notice ventricular pressure, even though it's falling, is still higher than atrial pressure, and so as a result, the atrioventricular bicuspid valve remains closed. Since the semilunar valve is now also closed, ventricular volume remains constant at end systolic volume. Relaxation of the ventricle continues, and we enter a period of ventricular filling, which we're going to split into two predominant phases, the first of which we'll call rapid filling and diastasis. During this time period, the ventricle continues to relax, volume continues to expand, pressure continues to fall, and notice atrial pressure on the left side has been increasing because blood's been returning to the left atrium this whole time. As soon as atrial pressure is greater than ventricular due to ventricular relaxation, the bicuspid valve opens. Notice the semilunar aortic valve stays closed because pressure is greater in the aorta, and the instant that bicuspid valve is open, blood can now move passively into the ventricle. Now it's crucial to note here, blood is moving from the left atrium to the left ventricle because it's moving from high to low pressure. The atrium is still itself relaxing. It's not contracting yet. It is still also relaxing. And so blood volume in the ventricle begins to increase. Notice during this time, atrial and ventricular pressure remain relatively constant. Atrial pressure remains constant because as soon as blood goes into the ventricle, it's replaced by blood returning from the systemic circuit, from the pulmonary circuit. And pressure in the left ventricle remains relatively constant because even though volume in terms of blood is increasing, the ventricle is relaxing, so the space that blood can occupy is still increasing, and so the pressure remains low and relatively constant. We'll reach about 70% of end diastolic volume through this passive filling that occurs purely because of ventricular relaxation and the pressure gradient that results. At this point, we move into atrial systole and what might be called active ventricular filling. The P wave of the next EKG at the SA node produces atrial contraction. That atrial contraction causes a jump in pressure in the atrium, squeezing blood into the ventricle. That also causes a slight bump in ventricular pressure. As atrial pressure is still higher, the valve remains open, the aortic valve remains closed, and the contraction of the atrium pushes the ventricle to end diastolic volume. And if you pay close attention, you'll notice we're right back where we started. The next video will do a summary step-by-step of what happens in each of the phases. I'd encourage you to watch this one again to get a sense of the activity, and then watch the next video to see how to summarize this as briefly as possible.